if you know you have a partner, tell you, hey boy, having problem urinating, having certain issues, then let us know, and we will actually be able to, to give you and render some assistance. So, prostate problems, fellas. What are we talking about? So the thing is, as we get older as men, there could be a point in your life where your prostate is going to start to enlarge. It's going to start to get a little bigger than it was before, where when you was like 20, 25 years and thing, right? So the thing is, gradual increase in size of the prostate is not necessarily alarming. Gradual and really gradual in small increments, because that is expected as you age. Now, here when the problem comes in when this fella started to swell a little bigger than he's supposed to. So he started to behave bad, you feel he feel he's a big boy. And he started to just swell out of control. And fellas, that is when we in problems. Serious problems. And here why this thing serious, fellas. Because they reach a point now, and no fault of their own, because remember, I was telling you that when you look at medicine as regards to Batson and Associates, we look at the body from 5 specific aspects: spiritual, supramental, mental, vital, physical, body. And that's almost to the point of high science. Right? Plenty of people don't understand that at all. But if you really break it down and look at it from an open-minded perspective, you would understand. But then a lot of persons not open-minded. Keep that in mind. So in any case, yeah, fellas. So they're cutting off prostates now. Yeah, it have plenty fellas right now who, and I'm not saying this to be condescending, to be rude, to raise dog from sleep kind of thing, but sometimes people have to be shocked into reality as regards to what they need to do and how they have to take care of themselves, right? Um, because yeah, it have men right now who don't have the prostate. And let me explain something to you, fellas. They're going to tell you, there's going to be some doctor who going to look at you straight in your eye and say, boy, here, what if you cut off your prostate, it wouldn't affect your sexual function. Listen to me, I wish there was a meme that I could put up for you to see right now to tell you how that is so not true. That is not true, fellas. It is not true. It is not true. It is not true. Let me tell you something. You're going to lose size. And all of us is big people here at children listening to this program, so I'm going to speak like if I'm speaking to adults, right? You're going to lose size. You're going to lose interest. You're going to lose sensation. Fellas, you're going to lose a lot of things. So don't let nobody pull wool over here and talk that nonsense for you, right? You're going to lose a lot. And some tablet going to become a very good friend because you mightn't be able to function without it. All you know how I just operate. I just tell all this straight up. I don't have time for games, right? So that, in my opinion, is not an option. Nobody ain't come and tell me you're going to cut out my seeds. Madness. Madness. According to them, heresy. I ain't going through that. But the thing is, fellas, you cannot reach in that situation where you have no choice. Because that is happening now. People just talk big, big. I'm not doing that. They're not doing this. I'm not taking chemo. I'm not. You could say what you want. When you're sick, listen to me, you just do anything to feel better. Alright? Anything you just do to feel better. So don't play ignorant and stupid and go down that road. Few people had that kind of belly. To say, what all, I done sick, I feel I ready to dead, all. I'm not encouraging euthanasia, of course. That's not what I'm saying. Let me keep it straight. What I am saying, there are few people who would say, yeah, what? I feel I ready to meet my maker. I think I make myself clear with everybody. I could dead now. People just say that now. But plenty of people don't mean that. Because when the situation reaches, tell them, if you're so bad, when you're taking, tell them to call the ambulance. And then, of course, you can't even say that because you might be thinking like that. But remember, you have loved ones. You might have a wife. You might have children. They're not going to leave you to die just so. In most instances. I go to say something if I don't think people might look at me differently. Because I'm not going to say I different, If it is you gave me all that problem and you feel you're ready to dead, well, here what? I don't know. I don't know. I'm not encouraging euthanasia, but I tell you, no, yeah, don't waste big people time. That's my perspective in life with a lot of things. But saying that to say, fellas, don't go down that road. An ounce of prevention is better than a pound of cure. Watch me, that people is come and talk to me. I have somebody right now, problems, and he have a young wife. Beautiful woman he's married to. Not being disrespectful, if you see this specimen, nice lady. And he in that situation and his problems right now. You don't know what happened to you. And your car vexed with the young lady. So, fellas, mind all your business. So, here what we're going to do. We have something special we're going to do for you guys at Batson Associates. And I'll tell you guys that in a little bit. But before we get into that, fellas, all you have to check all yourself. This prostate thing, serious, serious, serious. I'll tell all you how serious this is just recently. And let me tell you too, men, if you know you work with chemicals, you are at greater risk of having problems with your prostate. Well, I'm going to repeat that again for you. Men, if you are involved with chemicals, you all know what I mean when I say chemicals? There are some persons, their occupation bring them into contact with serious chemicals, some cases corrosive, cancer-causing chemicals. And in some cases, they are aware of that, and there are certain, you might be compensated well. Some, those jobs pay pretty well, and then some people, you might be working for yourself. But at the end of the day, who am I speaking about? Hairdressers. Yeah, men who are hairdressers, right? Because your hairdressers interact with serious chemicals. If you are a male, and you are a nail tech, same thing. Men who are mechanics, painters, if you work in woodwork, so you use things like lacquer, painters, right? Men who work in oil and gas, if you work in factories, if you operate machinery that exposes you to a lot of heat, watch yourself. If you handle dangerous chemicals, fellas, you are at risk. The most cancer patients that I have treated in my years of work with prostate cancer were men who interacted with chemicals, especially persons involved in agriculture. So you have to be proactive if you're in those fields. So again, let me give you those telephone numbers and locations. We are located on the first floor of Money Talks building. That is Money Talks building in Montrose, Chagonas. That telephone number is 222-8261. That's 222-8261. Debe is the corner of Ramsey Trace and the SS Erin Main Road in Debe. That number for Debe is 223-7515. That's 223-7515. St. James is Red Edge Mall, Western Main Road, St. James. That number for St. James is 220-8113. That's 220-8113. And Tobago, of course, is the Triangle Building in Scarborough, Tobago. That telephone number for Tobago is 226-4553. That's 226-4553. And as well as 312-4248. I believe 312-4248 is our WhatsApp number. So you can WhatsApp Latoya at that number. That office is located in the Triangle Building. Easy office to find. We actually relocated from where we were. Now we are a much larger space. That's a new office that we did there. Of course, we put everything in place for you guys now. So as of next week, we have our consultants in office, and of course, yours truly, Dr. Batson, would be in Tobago and available in Tobago via different means for this entire month here. So, of course, take advantage of that. And I would just, of course, be doing your reviews. Keep in mind, if you have blood tests that you want to bring for us, ensure that you copy those tests and bring it for us. And we would be able to, of course, dot our I's and cross our T's as regards to giving you a proper assessment. Keep in mind, we are live on our social media platforms. Let me say a pleasant good morning to Mr. Rachel Johnson, who is on our Facebook. Miss Pamela Moses, good morning to you. Miss Heather Lawrence, as well as Miss Sandra Bedo Amora. Miss Kamala Samaru, good morning to you. And of course, Miss Kathleen Ishmael. Mother, pleasant good morning to you, my dear. Keep in mind, we are live again on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. And on TikTok, we are Batson and Associates. So, that is where our conversation begins. It doesn't end there, of course. I will keep speaking about prostate as we go along, but of course, I will entertain your questions, your concerns, because you may have various issues that you're dealing with, and you might be looking for some answers. So, of course, I'm going to pass you over to the lovely, just remind me of your name, my dear.
Adana.
Adana, it is? A-D?
Yes.
Adana.
N-E, yes.
Adana. Okay, Adana. So,
Yep.
Adana. So you will just open the lines and let them know the various contacts, and we'll go from there.
Right. So before we open the lines, we have a few WhatsApp messages, and a few persons are asking if you can give them the early symptoms of prostrate
Issues.
health issues.
Okay, good, good, good. Of course. The thing is, prostate symptoms are varied. In some cases, they they can be reliable, and in some cases slightly unreliable because it could be unrelated. Okay. So let's say, okay, frequent urinating at night is usually an indication of prostate problem. However, keep in mind that is also a symptomology associated with diabetes as well, right? But of course, if you have frequent urinating, so let's say you drink water in the night, which you can drink water, maybe an hour before you go to bed, half an hour before you go to bed. And let's say you get up maybe like about 12 o'clock and you urinate, and then you get up maybe 5 o'clock in the morning. Then that's basically normal based on the amount of water that you would have, consumed. But if you find you get up 11 o'clock, 1 o'clock, 2 o'clock, 3 o'clock. No, definitely cause for concern. Definitely, definitely cause for concern. Okay, so that's something that you could pay attention to. If you have delayed flow, so you find you go to urinate and you're standing there for a little while, and then you actually starting you have starting and stopping. So let's say now you actually think you finish and then you put away and then you realize you start to wet yourself. That is definitely a cause for concern. If you have problems with burning while urinating, that could also be some indication as well. Any sort of pain in that area, which is usually rarity, but in some cases I've encountered men with prostate problems who have complained of pain. So if you're getting unusual, strange pains in your groin and you didn't hit yourself, you didn't fall down, you wasn't in a fight or anything like that, then that could be cause for concern. One of the things we do at Batson Associates, I am big on diagnosis and diagnostics. So we have a PSA, which is normally used in the labs. Those are the prosthetic specific antigens tests. That is usually good. However, it is not the most reliable, but most of the time, if you get a PSA that is elevated, it is a sign of smoke. You know what they say, where there's smoke, there's fire. Of course, prostate ultrasounds are better. I am not a fan of biopsies, and I say that blatantly because I think it's a little too extreme, a little too invasive, and the consequences associated is too much. At Batson Associates, when we do the blood analysis, a blood analysis would give us some indication. Even the magnetic resonance analysis scan that we use, which is MRA, which is similar to MRIs, but MRIs are magnetic resonance imaging, right? Where it actually indicates prostatic hyperplasia. It can indicate prostatitis, which is infection of the prostate. Keep in mind that all those things actually cause swelling. There's also urine, a specific type of urology type testing where they test your urethra and your urine and different things. So that's a barrage of tests that actually looks at the health of the urethra and that type, because usually that indicates problems with the prostate, because those organs are basically linked, right? Your kidneys, your prostate, urethra, that type of thing. So if you are someone who holds up your urine a lot, you don't drink sufficient amounts of water, those are some of the things that you could look for. Okay.
Right.
Next question. Yes.
Get in on the inside. The numbers to call 624-7729, 625-2759. You're listening to the program Overcoming Health Issues with Dr. Jason Batson of Batson and Associates Limited. Right, let me see. Oh, your friend Ingrid, she sent a voice note for you. See if I can get that.
Mhm.
Hi, Dr. Batson. Good
Hey,
morning.
there's a lady with a nice voice.
Well, I had a doctor appointment Thursday to see a bone doctor. So when I went, I see him. He said he will have to do therapy and surgery. I said, what? I said, doctor, I said, see that surgery, that is not my cup of tea. I said, knife is for the kitchen. He said, well, it's up to you, You have to decide if you want to do the surgery. I said, doctor, I will do the therapy. But right now, see that surgery. I say, I say, that's a no for me. I say, me try the surgery and see what's going on. So I say, I will go and do the surgery, not the surgery, the therapy. I will go and do the therapy next year and see what will go on. I hope all is well. But tell me, it's therapy and surgery, and that is not really my cup of tea. So I think I want to go and get a second opinion, but I've got to find myself by you. I have to find myself by you because that surgery is not of my cup of tea. So I'm locked on and listening, and you have a wonderful week.
Yes, my dear. um, lady with the nice voice. What's her name?
Ingrid.
Ingrid. Okay, Ingrid, and easy, you know. Um, what I will say, I mean, therapy is always my first line of advice as regards to injury, or in this particular case is a bone situation. So we're speaking about the musculoskeletal system, right? So when you're talking about musculoskeletal system, inflammation or diseases associated with that would be things like arthritis, sciatica, which a lot of persons suffer from sciatica. Sciatica is when you have herniation of the disc in the lumbar region of the spine, and then it actually causes pressing on the sciatic nerve, and that radiates down. We use most of the time the left side. It could be very painful and annoying at times. Then you have things like osteoarthritis, which is arthritis but with a bone density situation where the bones are less dense than they're supposed to. Then you have a rheumatoid arthritis, which is really terrible because there's actually inflammatory response in the bones themselves. Now, all of these issues or aspects of inflammation in the musculoskeletal system could cause a number of problems, primarily pain, discomfort, issues with mobility, that type of thing. So you would find that persons are told that they have to do knee replacement surgery because you may have an old injury, or I, I am always last resort for things that are invasive. And I mean, the Hippocratic oath that all doctors take, even doctors of integrative medicine, is to do no harm, or to do the least amount of harm where your patient, or well, in our cases, our clients are concerned. So it's always therapy for me. I'm a big advocate of massages, cupping, huge. And those are some of the things that we're going to actually be starting when Londonville is opened up, because we have a lot of work to do as regards to our arthritis clinic that we're going to have there, diabetes, stroke center, those type of things, because you need rehabilitative work, which is therapy. So yes, I am for the therapy, always first resort for therapy. What always works well is therapy with nutrition. And that's where Batson and Associate comes in. And that's why I always recommend our clients to chiropractors, professionals, and work along with them in terms of their dietary aspects. I use a lot of nutritional protocols that would help the body to heal faster than not regular. Because you can do that. I always say it in a colloquial way where I say we have thing for thing, but in a professional perspective, what I really mean to say is that there are so many things. You remember at the genesis of our conversation, one of the things I said is that, a lot of people think about herbs and they just think herbs and that's it. But when you look at what nutrition really encompasses, and they still discovering new things, because mankind has just scratched the surface as regards to what you find in plants. And I mean, they didn't need look at most of the medicines in the world. It comes from a lot of plants from the Amazon rainforest. That didn't happen over a period of time. That was years of study and research. But you think they find everything? There's so many plants that we don't know about. I'm convinced that there are places on the earth that mankind just has not been as yet. I'm sure. So, there's so much that you have as it relates to nutrition. As I was speaking about things like anthocyanins, you have things like riboflavonoids, and those give like berries and cherries their color. That's a whole aspect of nutrition by itself. Look at something that a lot of persons use for their eyes, which is this thing, lutein and zeaxanthin. Those are fall in that category of I believe anthocyanins and that type of thing. Then you have nutrient dense foods. So there's so much that you have available, but you just may not know about it. And that's where the clinical nutritional specialist comes in, and which is Batson and Associates primarily. We that is one of the areas that I am specialized in, and of course our organization does that on a very wider scale. Okay. So again, keep in mind those telephone numbers and locations. Men, one of the things that we're actually going to do for men, and I know I'm going to get bad up for this as the young people say, that's what they say, bad up, um, is until the end of this year for men, because I know the end of the year is a kind of funny time, economically, and a number of Ollie, because it's Christmas and you have children and whatever the case may be. So you know how that is be. But of course, remember your health is your wealth. So what we're going to do for men is we're going to provide a particular discount for you guys as regards to that entire test. So that live blood analysis, magnetic blood analysis, live and dry blood, that entire consultation you could do. But of course, we know, next year you could decide to organize yourself. Because I know Christmas, some people they say, hey, Dr. Batson, it's Christmas, so you might want to eat and thing. But keep in mind, Santulan, you could make sure and pass and get your Santulan, because I'll tell you why, your Santulan and your alkagen water. So what happened is for Christmas, when you eat the little black cake and the little puncher creme, the blood pressure wouldn't go too high, the sugar wouldn't go too high, and you'll maintain, a certain level of cleanliness in the intestines. So, that is a good maintenance tool. So, guys, you could come and have a test done, take a little maintenance tool, and then next year, God's willing, get yourself on a better gear as regards to prostate health. Because you don't want to get up a morning or night or evening to urinate or go to urinate and then realize you cannot. That's our next surprise that a lot of men get in. Within the past, well, we're in 2023, since the beginning of, so mid 2021 to now, I have found our prostate clients has significantly increased. Like, I mean, that's because of the results that we get, because a lot of people refer us now, thank God for the good work that we do. And, the persons that we have helped, because there are persons who came to us who were wearing catheters and they no longer wear catheters. There are persons who came to us who were targeted or not targeted, sorry, who were supposed to have prostatectomies, where they actually had to have the prostate removed, and different things that they wanted to do, brachytherapy and those type of things. And because of the treatment protocol that we gave them, although their numbers increased, they began urinating on their own and that type of thing, and they didn't have to, So I've found that increased significantly. Tobago is always a huge number, or a lot of numbers with prostate health. I believe where prostate health is concerned and prostate cancer, Tobago is one of the at least top 2 or top 3 in the world. They really have a severe problem associated with prostate health. I strongly believe I know what significantly contributes to it. A lot of people don't like to hear it, but I believe is that heavy consumption of pork, because they do consume a lot of pork. I mean, and the diet is a lot of hydrogenated oils and fats. That's going to give you prostate problems. Definitely, that's going to be high inflammatory. It's going to cause high inflammatory markers in the body. And those high inflammatory markers, inflammation propels disease. The higher the inflammatory response, the greater the disease, or the greater the environment become conducive to causing disease. That's why in Western medicine, one of the things that is that if you have a high ESR, and I think before, I am one of the first doctors that actually started speaking, so vocally about ESRs. ESRs are tests for erythrocyte sedimentation ratio, right? And what your ESR does, that tells the level of inflammation in your body, right? And if your number is more than 100, your likelihood of getting cancer is significantly increased by about 90%. And that's why we have so many cancer. Someone was asking me recently, Dr. Batson, why are there so many persons with cancer? When you go down to the cancer clinics in Trinidad, because we have an international audience, so that's why I'm saying that. So when you go St. James and you go San Fernando and that kind of thing, what you're realizing now is that you're seeing more and more young people, young men and young women, prostate cancer, women, breast cancer, ovarian cancer is on the rise. Why? Because of the exact same thing. Inflammatory, simple enough. I tell people I know maths and physics and chemistry in this thing. Well, I mean, it does, but I mean, in the grand scheme of things, it really not hard to understand. So if you're someone who consumes high amounts of alcohol, if you're a smoker, you're already would have high inflammation. So I tell people, if you're a smoker, you need to do things to negate the negative effects of smoking. So you can't smoke, drink, have 9 million women. You know, you can't, it's just like do everything bad. Come on, man. How you gonna do that? Pick a struggle. Pick something. Pick something. Though you can't have everything. And then you ain't taking care of yourself. You do exercise. Come on, man. No, but come on. What are you doing? What are you doing?
Dr. Batson,
Yes, go ahead.
they said, good morning, I'm a mechanic. What can I do to help with prevention of prostate problems in the future? Is there any detox or anything other than preventative measures? So I'm guessing they can't leave their job.
Oh, yeah, the thing is, even, okay, so there are a number of preventative measures that you can do, gentlemen, ladies who are involved in this. I'm a big advocate of Santulan, obviously, because I mean, Santulan is a product that I've been using over 14 years now. Prior to Santulan, there was a product similar to, and then Santulan was just basically a betterment of that particular product. So I've been essentially using a product or like Santulan for about 25 years. Right, it's something that I've recommended for family members even before I actually started to work and do this type of work that I do here. So I would recommend Santulan 7-channel detox. Why? Because of the amount of chemicals that you're exposed to. So Santulan cleans and detoxifies kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. We also carry a product called inflammation formula. And that product was specifically designed to reduce inflammation in the body. And it works. It works. There's nobody that ever used that product, especially for pain, and didn't come back for it. For swelling, it works. Um, Home remedy, one of the things that you can do, it would start to give some help as well, is baking soda. You take like a half teaspoon of baking soda in 8 ounces of water. You could do that every other morning. Keep in mind, when you work in certain types of jobs, keep in mind chemicals enter the body in 3 ways, right? So it enters via the skin, dermally, it enters via your eyes, ocularly, and it enters via your respiratory system. Okay, that is how chemicals enter the bloodstream, or enter the bloodstream. Good. So if you're someone who painting, you're gonna inhale that. Even if you're wearing your mask, those things could actually get on, because remember, when you paint, there's a mist that creates, so that could actually fall on your skin. So dermally, and then ocularly, people have no idea how many things go in their eyes on a daily basis, which is why I remember meeting someone who they got blind with glaucoma. And whenever I hear persons go blind with glaucoma, I know they had to be serious issues that would have contributed to that. So in speaking to the individual, I said, your job, you used to deal with chemicals? And he smiled. He said, how you know that? I said, because that could have been the only thing that caused you to lose your eyes so quickly. So what he did, he was somebody who used to spray. He used to do lacquer and spray painting and stuff. He was a joiner, or is a joiner rather. The person is alive, but they're blind. And that's why. So all that chemicals enter the body via your eyes. And what happens is that obviously the pressure in the eyes would have been compromised, because one of the things that he also didn't used to do, he didn't used to drink water. So you see, and the thing is, a lot of persons who work in these jobs, and I don't understand why they don't take precautionary measures. Because let me tell you something, and this is not me trying to get a lawsuit here, but the thing is, a lot of the jobs that sometimes you do, they themselves not even aware of the dangers.
Yeah.
It might sound ridiculous, but they're not. People who work in gas stations don't understand what they're exposed to on a daily basis. Whenever I go to put gas in my vehicle, you will laugh at me. I am very far from that pump. I refuse to smell that. Refuse. I cannot stay in a gas station for a long period of time. I have a very good sense of smell. It automatically gives me headaches and that kind of thing. Of course, chemicals affect people at different degrees. But the thing is, once you're there for a period of time, you're going to have problems. Do the research, check it. Women who work in gas stations, if they check if they have problems with fertility, they have problems with their menstrual cycle. Sometimes, a lot of the times, your issue is occupational. Now, I don't know what is your contract with your employers, and that's why I say I'm not trying to get a lawsuit. But you need to be very careful and take care of yourself, because you have to work. So some people might be able to say, yeah, but I live in this job. This job might be too dangerous for me. But the thing is, in those industries, you are compensated. I remember when I was young, I wanted to be an underwater welder. That's the job I wanted to do. And one of the reasons I wanted to do the job is because I knew the job was a well-paying job. But I also, like the sea and deep sea diving and that type of thing. And then only to realize that, that job is a very serious and dangerous job, but that's why it pays so well. But I like medicine and I was very good at it. So here I am. And I always wanted to be a doctor in any case and help people and, work for myself primarily. So that worked out pretty well, okay? But I was always service driven first before the money. And I always tell people, build a good reputation and everything will come afterwards. Right? So I'm saying all of that to say that is what you need to do. Yeah, in those jobs, take care of yourself, please. So you can at least use the baking soda, a half teaspoon in 8 ounces of water every other day. If you are hypertensive, be a little careful with the baking soda. Try and stretch it out maybe as opposed to a half teaspoon every day or every other day. You do it like every 4 days, and you can do that for like about 2 months. And then you stop and then you do it a next period. As I said, Santulan 7-channel detox cleans and detoxify kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. Because sometimes depending on your level of exposure, remember each person's level of exposure are going to be different. So sometimes your protocol is going to have to be designed for you specifically. What might apply to person A may not necessarily apply to person B. Okay, we have a question.
Yes, someone is asking, they said, with regards to cartilage in the knees, what is the measurements of CMOS to unsweetened gelatin?
Oh, okay. So the CMOS is 2 tablespoons and the unsweetened gelatin is 1 tablespoon. Okay, so that's 2 tablespoons to 1 tablespoon. Right? Keep in mind as well too, when you're doing that, ensure that you continue to drink your water. One of the products I would recommend as well, inflammation formula, because that actually helps. Because you see, when you reduce the inflammation, what you do now, the body is able to heal itself faster. Remember, that's very important. People don't understand how inflammation seriously contributes to disease. Inflammatory chemicals, for example, and you can research this if you look at something called prostaglandins. Prostaglandin is actually an inflammatory chemical that literally causes issues when you in the body. When you have visceral fat actually produces those things which increase inflammatory response in the body, especially while you sleep. And once inflammation is high in the body, it becomes very oxidative. It begins to break down. So chronologically, you might be 50, but biologically, you might be 150. And believe me, that's not an exaggeration. I've seen it already. Next question.
So we have a voice note here.
Good morning, Dr. Batson. I wanted to find out something. Some years ago, I had like more than 1 penicillin injection. Recently, my foot got injured and I got penicillin injection. The penicillin tablet for a week. And I find that the old penicillin injections that I had gotten, the spot that I got it on, I started paining me now. And I want to know what caused it to start paining me now and what I can use to ease up the pain. Have a blessed day. And when you're having the symposium in Shogunas, thank you very much.
Yes, yes. Okay. Symposium in Chagonas. We're looking at how the year end is shaped. It is the 12th of November already. So I'm not too sure if we'll be having any symposiums for this year per se, but I mean definitely from next year we'll be looking at. I'm not saying no entirely, but I mean I'll speak to some people next week. Please go on and we'll decide exactly what we're doing. But definitely, if not the end of this year, definitely from next year, please God. Okay. As regards to the question with the thing is, again, inflammatory response. I mean, if it is you would have gotten that injection and then after you got the penicillin injection again, it could just be, and then the injection sites normally just tend to be painful or give problems afterwards. So it could just be that. What you could possibly do is soak your foot in some Epsom salt. Get some Epsom salt and put it in some warm water and soak your foot for maybe like about 30 to 45 minutes. That should give you some help there. Apart from that, of course, your cleansing and detoxification is important. I don't know when was the last time you did that. I tell persons there's a complete difference between a purge and a detox. Santulan is just that, a detox. right? Because of its ingredient profile and the way it is designed, is to gently but effectively cleanse those 7 channels of elimination: kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. I said, I personally have used it for like about 25 years, and actually brought it to market in about the last 15 years, Santulan, because we used to use our product before that. So I've seen the results that product actually does. What I like about it is its usability. It's very easy to use as a liquid, because I don't like capsule detoxes or tablets. I mean, if because there are certain ones depending on what I'm dealing with, especially if I'm dealing with someone with like colorectal cancer, colon cancer, that type of thing, we may have to up the ante a little bit specifically. But that's where specific comes in and not what is general. Santulan is general. Almost anyone could use Santulan. The only thing I tell persons, or the persons who not supposed to use Santulan, is someone who's anemic, i.e. it means you have low blood counts. Then we're going to have to build you up first before you actually use the Santulan, because even though it's a gentle cleanse, it is effective. Once you're doing liver detoxes, or it's dealing with your liver and your gastrointestinal and your lymphatic system, which is very important, it's going to bring down that blood count a little lower. That is going to happen. So an anemic person, not at the initial aspect, you would have to consult with us. It's easy, just call the office and ask, and we will let you know, or come in. Someone who does not drink water, and I'll repeat that. If you do not drink water, what do I mean by do not drink water? Okay. Easiest way for you to calculate that is your body weight divided by 2 in ounces. So check how much you weigh, divided by 2, and then that 2. So, okay, let's say you're 160, half of 160 is 80. You're supposed to drink 80 ounces of water. If you convert ounces to liters, that will give you what? You could punch that somewhere in the internet. I think it will give you something like either 2.1 liters or something like that. That's how much water you're supposed to be drinking. And you should have been drinking for the last 2 months or months. So if you wasn't doing that, then I suggest you get and start to drink water, and then you can use Santulan. Why? If you do not do that, you're going to end up with breakouts. You're going to end up feeling nausea. Things going to come out on your skin. Why? Because your inside is too toxic. And you'll end up with what we call healing crisis, which is when toxins try to leave your body faster than you want them. They will leave, but we don't want you. We want your skin to stay nice. We don't want you to end up with bubble. We don't want you to end up with feeling nauseous and vomiting, and then you want to go and tell people Batson Associates right to, no, we don't want our reputation. So let's do what we're supposed to do. Correct. I always tell people there's a correct way to do things. So I think I covered those. Just those 2 people can't use Santulan. The elderly could use Santulan. Children could also use Santulan, but of course, let us know the specific information, and we would guide you accordingly. Santulan is a product like anything else. It is used as directed or as recommended by a healthcare provider, because the healthcare provider, which in this case is Batson Associates, will be able to tell you exactly how to use the product. Because what you have to keep in mind, there is also maintenance dose, and there's something known as therapeutic dose. So let's say, for example, you come to me and you have cancer. A cancer protocol is a therapeutic medical protocol that we're going to have to put together. That's not going to be standard. So if you're using, let's say you're using glutathione, which is the master antioxidant in your body, so we're giving you a glutathione supplement, it means that we're now going to have to up that, as opposed to using 1 pack a day, which is what I just use for maintenance, or 1 every 3 days or something like that, because I use other things. Then it means for a cancer patient, they're going to have to use about 5 packs of that for the day, because that's a therapeutic dose, because we are dealing with an emergency situation. Okay, so you all have to understand that that is how it applies. It depends on the individuals. Okay, we are all the same, but our circumstances as it relates to health may be different, and of course, we would have to adjust accordingly. Good. Keep in mind quickly before we take that telephone number, our locations. We are located on the first floor of Money Talks building. That's Money Talks building in Montrose, Chaguanas. That telephone number for Chaguanas is 222-8261. That's 222-8261. Debe is the corner of Ramsey Wood Trace and the SS Erie Main Road in Debe. That telephone number for Debe is 223-7515. That's 223-7515. And as I said, what we'll do until the end of the year, we're going to give men, ladies, I know a little bash me next year, I'll deal with you all. Will, ensure that they get some discount towards that executive consultation that we do. So fellas, you could dot your I's and cross your T, and line up yourself, for next year, God's willing. Right? That is a very important thing. And I'm just saying that because I know the time of the year it is, right? It is the 12th of November already, right? Keep in mind we are live on our social media platforms. Miss Dawn Ellis, I have seen your question and I will address it shortly. Just let me just answer some of these questions that we have on the Sky 99.5. Yes, Rich.
So we have a call on the line.
Yes.
Hello, good morning.
Hello.
Hi, morning.
Could I'd like to speak to the good doctor.
Yes,
Yes.
speaking. I'm hearing you. Go ahead.
I live in the City Valley area.
Yes, sir. So-
The water seems to be very clean and nice, I want to know if drinking water from the tap is a very good thing.
Okay, no problem. I'll answer you. Sorry, go ahead.
Meant by the bottled water, the good osmosis, and well, I understand that the people that manufacture the water, they clean, the water. So I just want to know if the water is good to use directly from the tap.
Okay, no problem.
Yeah.
Okay. Right. So there's a question I often tell persons, if my attorney is listening to this program, they'll call me now and say, Dr. Batson, careful how you're answering that question. All right. So here what it is I'm going to say to you. As regards to tap water, as far as I am aware, where Trinidad and Tobago is concerned, in terms of our water policy and in terms of how we filter our water and sanitation and whatnot, we are up to world standard, right? I understand we have one of the better quality of tap water in the world. I know, however, that water, most tap water, if not all, is processed using chlorine, right? So what I will say from a biochemical perspective or biochemistry perspective, too much of chlorine is problematic for the body, right? The thing is, we get more chlorine in our body via showering as opposed to drinking water. A lot of people do not know that, because remember one of the things I told you, chemicals enter the body, how? Ocularly through your eyes, dermally through your skin, and respiratory, right? So as regards to that, which is why I'm such a big advocate of cleansing and detoxifying, right? So hence Santulan. But in any case, what you should do, as I always tell persons, is filter your water. There are numerous filters out there. I could actually recommend. There's some that we used to bring in. We actually plan to start back doing that. And filter your water, right? Because the filter is going to give you actually clean and take out different aspects, as regards to any type of bacteria, that chlorine aspect as well. There are things that you can do with the water to get that out. So that's what I'm going to recommend you do, filter your water. As regards to bottled water, I mean, each company would have their policy as regards to their water. I can't speak about any other organization. I could speak about what we do at Batson Associates as regards to Alkagen, which is a brand that I could speak about, and that's actually alkaline water. I am a big advocate of alkaline water. If it is you can do it, get it. It does help. Because if you understand pH, which is percentage hydrogen, on that scale of 0 to 14, 7 being neutral in the middle, you would understand how that water is going to make a difference from a health perspective. And it's actually recommended in some countries, or actually graded as a medical device. I can't remember which number it falls in, but it is a medical device. That's alkaline water. So as regards to your other brands, do your research. And when you do your research, you make your picks. All right? That's basically what I could say to you as regards to that. But filter your water. If you tap water and economically, that's the best thing for you. Get a filter. Boil the water rather. You allow the water to cool. Of course, use proper utensils. So I don't think anybody cooking in aluminum pots again. And boil your water and, of course, filter it. And as Patrice Roberts say, mind your business. Next question.
Yes, someone says, "Good day, Dr. Batson. I was recently diagnosed with ovarian cancer and was told that I need to have surgery, but I do not want to, especially as I'm diabetic and I have high blood pressure and high cholesterol. What can I do to reverse all of this?"
Just not do read that over again for me.
I was recently diagnosed with ovarian cancer and was told that I have to have surgery, but I do not want to, especially as I'm diabetic.
Whoa.
I have high blood pressure and I have high cholesterol. What can I do to reverse all of this?
Whoa. Live by Batson and Associates. Definitely. You're gonna have to come. I mean, and this is me again, saying this as nicely as I could say it. I mean, that's a lot. That is a lot. So I don't know if this is the first time you're hearing about us or if you know about us, but I mean, if you know about us a while, you should have at least given us a visit, man. I don't know. I'm just saying. I don't know if you're somebody new, but that's a lot to deal with. I mean, ovarian cancer diagnosis is serious. I mean, just the treatment protocol is going to be recommended because it's going to be most likely surgery, and then you're going to most likely be recommending chemotherapy and radiation, or it may not necessarily be, but I mean, in my experience, I've known of a lot of persons who they tell you they're not going to give you chemo, they're not going to give you this, and then eventually you get it. Right? You have some serious health concerns, and I believe those health concerns could have actually put you in the position that you're in now. I mean, and I say that without, attempting to be facetious or disrespectful or condescending to you, but I mean, you know, you definitely have some work to do. You have some work to do. I don't know how to start to tell you how to address those things because I mean it's a lot. So it's definitely you're looking from a holistic perspective. What I would say to you is I hope that you have been drinking your water. Or if your first time you're here in this program, I suggest you do the mathematics I worked out, which is your body weight divided by 2 in ounces, and start to hydrate yourself. If you drink coffee, you need to stop. If you eat red meats, you need to stop. If you What you need to do is now have a whole grain diet. Get things in your diet like chia seeds, flax seeds. Try and up your nutrient dense greens in that diet. So you're gonna have to do some blending and juicing. You're gonna have to make a complete lifestyle change. As I said, I don't know you personally, and I don't know your circumstances, and I don't want to judge. But that's a serious that's some work you have to put in there. So I strongly suggest you give us a call. And and one of the things I often tell persons, because somebody might be saying, "You're telling the woman call you, don't know what's her financial situation." Okay, good. Let me address that because money, there's a financial responsibility for everything, right? The shoe you have on. If you're listening to this program driving, you would have paid for that car or somebody paid for that car. There's a financial consequence to everything, right? When it comes to your health, I'm a huge advocate of preventive, and I tell persons, I'm just giving you an exact idea. And you all know I do call price on the radio for a specific reason, right? And that's just because I was never, someone who pushed price first and those type of things, right? So let me just put it like this. If you come to Batson Associates and you purchase 1 pack of Santulan, 3 bottles of Alkagen water, 30 packs of circulation tea, or 30 packs of tea. So it could be multiple teas or a circulation regeneration tea. You have not spent $500. I'll put it like that, right? If you take 3 months to put together that money, it would do some good for you. If you use rough skin lemon, I mean, rough skin lemon a little hard to get. The other day I saw a man on the highway. I was tempted. I took almost all, believe me. He told me somebody else was coming free rest. That's why I didn't get it. Yeah, because it's a hard thing to get, right? But you do it. But my point is, do something daily to give yourself some level of good health. That's the advice I always try to give people. Because when I hear, and that's why I said you know, when the person called and said what she said as regards to the amount of things, I was like, you know, I mean, you have diabetes, you have hypertension, you have high cholesterol. Whoa, and now they come and tell you you have ovarian cancer. There's a lot. But I've seen persons in worse situations like that. I often wonder who are the doctors, because nobody could be coming to me for any length of time and you're in that situation. It would mean one of two things. It would mean either you're not listening to what it is we are saying to you, and if you're not listening to what we are saying to you, then you would not be our client for very long. So that's why I say I couldn't be the doctor in that situation. But then I do know the situation in its entirety, right? You know, but I'm saying that it often confuses me that people start off, you know, as a diabetic, for example, and then 2 years later you have hypertension, and 3 years later you have a cardiovascular problem, and 5 years later you're on a dialysis machine. You couldn't have been coming to Batson and Associate. I guarantee you that. That can't happen. Never. So it means, and that's why I always say, you know, I always quote Albert Einstein, the only people who do the same thing over and over, expecting a different results, are mad people. That is a height of insanity. If you're doing foolishness on a daily basis, I thank God every day that I was around older people, much older people when I was young. My great-grandmother, Octavia Batson, she died when I was 14 years, and she lived till what? Granny was what, 87 when she died? Somewhere 86, 87, somewhere around there. But the greatest advice that I've gotten in my life was from that woman. Greatest advice. And you know what I think she always told me? She said, let me tell you something. She said, you will always reap what you sow. Always, out a shadow of a doubt. You cannot plant mango and expect to get pawpaw. You will always reap or sow reap what you sow, sorry. Always. So the point I'm making is that if you consistently do things to not have good health and be not healthy, you're diabetic, you're not checking your sugar, you eating what you want. Let me tell you something. Diabetics who end up as amputees, and this might hit some people a little hard, plenty of them, they are the reason why they're in that situation. And this will hit a lot of people, going to get hit hard this morning, but all you know how it is operate. Yeah, because you didn't listen. Last week, when I did last week's program, and I spoke about hypertension, I know that hit plenty of people hard enough. I know that. But I am the type of person, you all know me by now, I don't have time for that. We serious. Is either we playing games. When we playing, we playing. When we working, we working. And when coming to your health here, we working. You want to come by Batson and Associates, what, for 10 years and spend how much, what, $99 million and go and tell people Dr. Batson and then take all your money? No, I'm not having that. We get you in there quick. You get results, and then you say, well, here what, Batson, a feel good thing here, what, have a little maintenance, because you always sell supplements and whatever the case may be. So I have clients I haven't seen in years, you know, but they are clients of ours. And if you see them, when I do see them, hey, Dr. Batson thing, you know, I do see you, you know, you're good, everything, whatever. I seen you on the live, you know, but I come in the office, I deal with Ms. Ramdan, I deal with Mr. Bastaman, I talk to Mr. Roma. So they get what they need to get. The thing is, you will always reap what you sow. So you like cigarettes? Okay, good. Smoke a cigarette. However, it have a consequence for that. But if you're smoking and you say, well, yeah, what? You know, every 2 months I will take a little cleanse. I'll take a clean out. I'll take a detox. Make sure I drink more water. The possibility exists you could smoke that cigarette and live to be 100. I tell you so. You know why? You're doing something to negate the negative effects of the cigarette. But you can't expect to, you like cigarettes, you like rum, you're doing the most, you don't eat good. Your job is a job where you're exposed to chemicals, all kind of thing wrong with you. You eating as you want, you know you have a little problem with blood sugar, but you drinking alcohol, you going out, you're like, my boy, okay, good, no problem. The time is going to come where your body is going to say to you, hey, pay up. Today is the day that you reap what you sow. And then you start to get erectile dysfunction. So you can't function properly. Then you start to get diabetic neuropathy. Then it's because you get choke in your foot, and then it's because something happened and they cut off a toe. And then from a toe, they cut off your instep. And then from your instep, you have no legs. That's how it is happening. And again, I'm saying that not to, aggravate anyone, because I know there are persons who must be listening to this who know of what I'm speaking about that actually happened to persons. Because I live it every day. I see sick people every day. I see sick people. I got to make sure I say my prayers and things. Every day you're dealing with sickness. So you got to guard yourself. That's the things you need to do to take care of yourself. Right? But that's the job that I take. This is the job that I love. But you have to understand that you cannot do everything bad. You can't do that. You have to manage. You know you're diabetic. We know Christmas coming. Do you know that Christmas and Carnival time is when the hospital does have the most diabetics and hypertensive patients coming to them? And I'm asking you, I'm telling you that. And the reason for that is because everybody Christmas coming up, you can like black cake more than Batson. I tell all this. I love a black cake, Watch me. You Lego me on some black cake, that is it a gun. But in the back of my mind, I just have something, a voice telling me, hey boy, you can't eat too much of the black cake. And next thing I realize, I do not consume milk. I am not a milk, dairy, and that type of thing. But you see, punch a creme, you could catch me, Depending on the day, you could catch me. So I just watch myself. When I know I buy it, I don't want one bottle. I don't want none. Or they don't bring none. Don't tell me nothing. Gift, wherever the case may be, I cannot drink all that punch a creme. So I had to exercise some kind of. So everybody have their little things that they like. Nobody say no. But you have to understand that consuming this on a regular basis is going to make me sick. You trying to tell me you so licorice, you so greedy, you like food more than you like yourself? Nah, man. Nah. What you doing? What you really doing yourself? You like rum so much, you can't stop drink? Nah. And you know your liver mashing up, your kidney mashing up, you have 1 foot. So you tell some people the cigarette, you know the cigarette kill. I met somebody who had lung cancer. And come to me, And it's because his wife will tell me, Dr. Batson, before you come up here in the car, you're smoking a cigarette. I say, what was man? I let loose on you in my office. Talk about get on back. I say, sir, after I finish speak to you, don't want to come back here today, but don't come here to waste my time. And this was he revisit, so it means he was dealing with me. And he promised that he give up the cigarette. I said, no. Look, somebody know me good here, boy. Tish WBC and fudge. Yeah. I just stay away from fudge. Don't bring fudge by me, No, serious, especially if it's a coconut or a sauce of fudge. Watch me, I'm dead. I'm running. So let us do what it is we're supposed to do now. You all know Christmas coming. Pass by Batson Associates, get a little alkagen water, get a little santulan. At least the santulan will balance you out. Because I'm telling you, it have certain things I would not eat throughout the year, but for Christmas, I'll take a little taste. Black cake, punch a creme. So I'm making sure my santulan done line up there. Watch my santulan make already, and it's done the 12. Fridge working. Once your fridge working, good santulan can stay in your fridge for months. I tell you so. So I know when I go home, a little 1 or 2 get together and thing, I have a santulan to drink when I reach home. All right, so all you follow suit. Those telephone numbers again for the Shogunas office. That number is 222-8261. That's 222-8261. Debe is the corner of Ramsey Much Trace and the SS Erie Main Road in Debe. That number for Debe is 223-7515. That's 223-7515. And fellas, what I forget to say, this month, the product for this month, which has a special and have a discount associated with it, is prostate formula. So fellas are lining all up good for the ends of the year. So next year January is me and them ladies because they would not forgive me.
Sure.
They would not forgive me. Next question.
Yes. Is there anything that can be taken for severe sciatic nerve pain?
Yeah, we have treated a lot of persons for sciatica. Let me tell you something. When you're dealing with sciatica, you must have that physical manipulation, so the massages, those type of things. At Batson Associates, one of the things, inflammation formula, big help. There's also an advanced omega that we carry at Batson Associates. A very good product. We didn't have it for a while, but we have gotten it back. We also have the that omega with the astaxanthin is also very good as well. And we also have Optimizer. Optimizer is a very good product because it is an adaptogen, so it actually helps with pain and pain management in the body. Right, as regards to your stretches, you can actually go on YouTube and look. There are specific type yoga stretches that you can actually do. And they have basic, advanced, basic, intermediate, advanced. You could always search it on YouTube. Let me explain something to you guys now. The internet is such a the internet is a place you could get very, very valuable information. It's a place that could cause a lot of mischief too. So it depends on your personality and what you're really out for. Right? So, look on YouTube. They usually have stretches. Ladies, especially Kegel exercises. This is something you're not strain too much. We deal with at Batson and Associates, PMS. Women with postmenopausal syndrome is such a terrible thing, so keep in mind your nerve restore. If you have problems with things like depression, anxiety, problems sleeping, nerve restore is definitely something that you should check out. And of course, God's willing, when Londonville is complete, that office is actually going to be things like physiotherapy and that type of thing. That's primarily what we'll be doing there. Colon hydrotherapy, a number of different services as regards to gastrointestinal, stroke and diabetic center, that type of thing. Okay, so again, that telephone number for the Shoguna's office is 222-8261. That's 222-8261. Let me say a pleasant good morning to Miss Cindy Hoyt. Good morning to you. She says, good morning, Dr. Batson and team. Happy and healthy Sunday to everyone. Honeybee. She's make sure and hail out her friend in crime, Honeybee. Let me say a pleasant good morning to Miss Rachel Johnson. Keep in mind, we are live on our social media platforms. Miss Annabella B from Tobago, pleasant good morning to you. She says, blessed day, Dr. Batson and viewers. Please like, follow, share, and tag people. Thank you so very much for that reminder. As regards to our dates in Tobago, Tintin Julian is asking, that will be from next week. So what date is next week? Monday. Well, today is what? The 11th? No, the 12th. 12th. Right. So from the 14th, God's willing, to the end of November. Okay, look out for that. You can call the office. That telephone number for Tobago, that office at the Triangle Building in Scarborough, Tobago, that number is 226. That's 226-4553, 226-4553, as well as 312-4248. That's 312-4248. I believe that's 312-4248 is our WhatsApp. It is, in fact. So you can actually message that number as well. And 226-4553. That's the landline. Okay, guys. Next question.
How often can Santulan be used?
Oh, okay. It depends. Some people, you can use Santulan like every 3 months. The course that we normally recommend is 4 packs. What we have experienced with some cases, there are some people depending, and again, it depends on the individual. Some people we give them 2 packs, which would normally be like a 2 weeks or a 3 week supply. Because 4 packs could carry you, if you use it every day, to maybe exactly a month. So anywhere in the vicinity of, so depending. So let's say you're someone who, you work in some of the industries we spoke about. In that case, I would do a pack of Santulan every 2 months. So, and you don't necessarily, like in my case, my maintenance for Santulan, I would drink 16 ounce sometime every week. Yeah. Or sometime every 2 weeks, depending on how every week. Yeah. Because that's maintenance. And if I'm doing the full thing, it would be 4 packs. So I'll do 1 pack, and then after that pack, I'll do a next one and a next one. Right? So you have maintenance as well as things. So again, you can ask us for your, as per you. And we could always recommend accordingly. But generally, you're looking at least 1 pack every 2 months.
All right. Someone is asking if you could repeat the baking soda mix.
Or the baking soda is half teaspoon in 8 ounces of water first thing in the morning. Try and get organic baking soda. Simply because it is better. I actually did some research as regards to that extensively. So it does make a difference, right? And it's half teaspoon in 8 ounces of water first thing in the morning. And of course, as I said, you can do that every other day. If you are hypertensive, then you need to be a bit more careful. So I would recommend maybe like anywhere between a quarter to the half teaspoon. But of course, look at your readings. And it doesn't have to be every day or every other day. It could be like every 3 days. right? Of course, if it is you come to us on this consultation, that type of thing, we would narrow it. And because I remember there was someone I had, and I recommended 1 teaspoon for that person, but that person was different as regards to when we evaluated them and we look at all their results and that type of thing. But general safety, you're looking at about half teaspoon and 8 ounces of water every other day. Okay. Keep in mind as well, as I said, those telephone numbers and locations for our international clients. For consultations, you could message us or call 868-373-2388. Again, that's 868-373-2388. You're listening to Dr. Jason Batson, the Senior Medical Director at Batson and Associates, where we support your health naturally. Keep in mind, we are live on our social media platforms. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. And on TikTok, we are Batson and Associates. You can like us, follow us, like us, share. In addition to that, let me say a pleasant good morning to Miss Annette Robinson, who's listening to us out in New York, Miss Cindy Hoyt, who's also, I believe, in New York as well. Pleasant good morning to you. And of course, over to you guys, Sky 99.5. So keep in mind, so it is now what, 10:54. So we have a little time. So ask your questions now. Those of you who may have, keep in mind any question that you may have. It may not necessarily be as regards to what we're discussing, but any question. Okay, over to you, my dear.
Yes, and the numbers to call 624-7729, 625-2759. And someone sent a WhatsApp here. Good morning, Dr. Batson. My husband and I are over 64 years and sometimes has elevated blood pressure and my thyroid underactive hypothyroidism. Can we use the Santulan before we come to see you? Thank you.
I would say first thing, alkagen water. Use the water. I wouldn't go Santulan as yet, because especially if you're hypertensive. The thing is, what has happened to a lot of persons, you have to look, sometimes some persons are hypertensive because of dehydration. So look at your water intake. That's the first thing I would recommend. Look at those numbers as regards to what we carry at Batson Associates, specifically for hypertension, which might be more effective in that. But of course, water governs all people. Remember to drink your body weight divided by 2 in ounces. Now, remember, you're not accustomed drinking water like that. So don't start and figure out for the first day you're going to be able to do that. You have to gradually. So what you may have to do if you're accustomed drinking none, start off with maybe 1 glass, 2 glasses for the first 4 days. Then you go up 2 glasses. So you gradually increase because you don't want to put your body in shock, because that could actually shock your body. Yeah? Because there are a lot of people who are dehydrated out there, especially coffee drinkers. You all know yourselves. Okay, and there's a tea we carry called circulation regeneration tea. Very, very good tea. That tea actually helps with blood pressure and circulation. Very good product. That's a product that we had before, and they actually improved on it, and we have a newer version. The taste is amazing. No milk, no sugar, but you wouldn't even want to think to put sugar in this tea because it's naturally sweet because of the ingredient profile in it. Well, not sweet, but it has a really good taste. Nice smell, everything. That's the circulation regeneration. Of course, we have hypertension tea as well. We also have circulation regeneration and balanced circulation. All those circulation products deal primarily with hypertension. So you could look at that. What I would always recommend for persons who are hypertensive, if you're not accustomed using cleansers and you are hypertensive, ensure that you hydrate your body properly for at least 2 to 3 weeks to a month. I'll explain something to you quickly. Let me give you an example. Beetroot. Now, beetroot is good for hypertension, right? However, if you are hypertensive, you don't drink water, and you just decide, well, you know, your wife decides she wants juice for you, and she just decides she going to drink beetroot for you. You know what will happen? You'll end up in the emergency room. You know why? There are things that have the ability to cleanse and do certain aspects, remove inflammation. But what that beetroot is going to do, the beetroot is going to elevate your blood pressure. You remember you're already hypertensive. You don't drink water, so you're dehydrated and you're going to drink beetroot. You're trying to kill yourself. That's exactly what is going to happen to you. You're going to start to get headache, nausea, vomiting. That blood pressure might reach 200 and something over 1 something. You know why? You are dehydrated. hydrated. That is why drinking water is so important, especially as a hypertensive person. Now, you can't just start and just run anything just so. If you know you're not accustomed drinking water, you decide to get some of that alkagen water at Batson and Associates, because it would make a difference, believe me, right? And you start gradually, you're going to realize, but wait, I'm urinating more. Because what the water starts to do now is balance the your intercellular, intracellular, extracellular fluid. So intracellular fluid is fluid inside the cell. Extracellular fluid is fluid outside the cell, right? You'll often hear when coming to pressure and those type of things, and they talk about electrolytes. You talk about things like sodium, potassium, magnesium, calcium. All those things affect blood pressure. So it's very important that you hydrate. A lot of people, you don't drink enough water. Okay, good. All is still telling me all they don't like how water this tastes. All is still trying that excuse. Please. It was never about the taste. It's about the functionality and the importance of it. And then you could always, do what they call this water, where you put a little bit of cucumber in the water, or a little I forget the fancy name they have for it. But you have to come up with a solution to drink water. Parents, especially with these children you all have now. I saw a blood analysis on a 6-year-old child, what it was. Watch me. That child dry like a biscuit. That child would drink no water. None whatsoever. When we spoke to the parents, she said no. I said, you all have to fix this. Soft drinks and juices do not compensate. They definitely cannot substitute. They are not a substitute. Infused, thank you, Tish WE. Infused water. So you have to get that water in your system, because what you're creating is an emergency situation. And that is why plenty of people in the hospital. Half of the people in that hospital because they don't drink water. I tell all this. So all the cancer people. Somebody might say, how is cancer related to dehydration? Okay, how is oxygen related to life? Take a bag and put it over your head and tie it and see how long you live. And that was me being very rude. Without apology. It does not make sense. It does not make sense. So hydration affects everything. Everything. You're all going to doctors and the doctor never asks you how much water you drink. But he writing a prescription for medication. You can't come to me with that foolishness. That's nonsense. What are you doing? So your blood pressure high, you come to me, your pressure, and I write in a prescription for you for hypertension. I didn't ask you how much water you drink. I didn't ask you how much time you going to the toilet. I didn't ask you what it is eat. And it's all their faces when I ask some all of that question. I asked a lady recently, I said, give me via example, what do you have for breakfast, lunch, and dinner? Lady lost it. She said, well, Dr. Batson, I said, give me via an example. If somebody asks you that question, gosh, what's going on with me and your name, Gil? Adana. I never know Adana in my life. If it was a Patricia or a Patricia or a Stacy, I remember that name easy. All right, Adana. Yeah, that they realize just now. Let me just. Okay, good. I'll address that question just now. First, I give in trouble. I forget my train of thought as regards to where I was going with that. No boy.
Just say, what if someone asks, what do I have for breakfast?
Oh, good. Right. Exactly. Thank you. For example, you think you can answer that question? I mean, I don't have to say it, but I'm asking. Do you think you can answer the question?
I can, yes.
You can, right? So, okay. So, for example, with me. Okay. Via example, what I would usually have for breakfast, lunch, and dinner. So, this is me here. So, breakfast in some cases would either be 3 boiled eggs, piece of if I'm having bread, it would be whole grain bread, so a piece of whole grain bread. Well, avocado in season now, so there's no forgiveness there. Avocado. So that's breakfast. I may have maybe some yogurt, or I might do a smoothie. Right, the smoothie would have things like I would put sea moss, in some cases peanut butter, but that's based on my whole dietary regime. I would have some nutritional yeast in there, that kind of thing. Via lunch would be like most of the time provisions or quinoa, with either fish, or if I'm doing chicken, it would be breast. Or in some cases, I would have a Caesar salad with chicken, which I would make or have prepared. And dinner would either be smoothie. Well, I kind of know in the gym, back in the gym, so I tried to put back on some size here. So I would eat like about 4 times for the day. So that's me. So, but the point I'm making is that when you hear what people eat, because usually you don't really deviate too much, people just kind of go around in a circle as regards to what they really eat. Some of them don't really realize it, because you'd either have rice with peas and chicken, or rice with peas and goat, or some cases you might have a salad with it. So we don't really deviate much. So just by asking that question, you could actually know what is in someone's diet. And then in addition, if I ask you, do you drink soft drinks? And you say, for example, yes. How often? You would say, okay, maybe. So let's say you have someone who comes to me who's hypertensive, and I ask, how much do you drink soft drink? Yes. How much times? One every day. As opposed to if you ask me that question now, I'll say zero, because I don't. I don't consume that at all, at all, at all. Right? But I'm saying that to say that it gives you an idea of your lifestyle. It's just like when someone walking out a grocery, and I am going to judge you because I'm going to be looking at that grocery basket, and I'm going to be looking at the person pushing the basket. And most of the time, the person pushing the basket looking exactly like what they have in the basket. Right? Yeah, and I say that again, that's me being very rude there, because it's a fact. You are what you eat. You are what you eat. You are what you drink. So when you look and I sometimes I see people passing, and she's killing herself here. No, but a story. You have never seen people pushing the basket and look at the basket and look at them. You'll never do that. All right. Now the thing is, Christmas is going to be a little Christmas is going to be misleading, because it's Christmas now. So a lot of people, that's like me, but I mean, you wouldn't see me in the grocery pushing a basket with punch creme and black cake. But I just saying, that was actually a real good one, right? I was just saying that, Chris, so people, so the listeners of Sky 99.5, we will not be judging people from this time here, because that's going to be skewed. We're not going to, our data wouldn't be correct. So what we're going to do, we're going to look at people from January. But seriously, usually people pushing. Now I know I'm going to be looking at people grocery. Don't let me know you hitting all the grocery. But now they're looking Marco and people trolley. But no, I just do that. I really do that all the time. I remember I was somewhere with my mom, and she's like, boy, what you doing? And I was like, Mommy, what? She's like, boy, stop it. Oh God, no, that's a real good one, bro. Oh gosh, no. I mean, I saw someone with this basket at time, and the basket was full of snacks. And I was just looking. I see the basket first, and something in my mind saying, I am sure this person is overweight. And when I looked up, the person was overweight. I tell my mother, I say, see, she said, boy, stop it. Just push your basket and go, please. But it's facts. So I saying all of that to say, let us do what it is we need to do. Remember too as well. So that's what is pertinent. So the thing is, your blood pressure high, but nobody's asking you, what are you eating? What are you eating? What are you drinking? Those of you with the coffee, well, I would hope that some of you are lessen down the coffee a bit now, because you understand the dynamics of coffee, especially as it relates to diseases that you may have. So you cannot have glaucoma and say, oh God, I love to have a latte. And, I love to have wherever the fancy thing is. You need to kind of be a little careful on that. Coffee is something you could have once a month. Like I went out recently with to a meeting, and I had one. It's not something that I regularly. I haven't had coffee in months. It's not something that I partake of, because I know it in abusing it. Because that's the thing with a lot of people, you're abusing it. It's not to drink every day. It really is not to drink every day. I mean, people don't like to hear that, but it's a fact. It's just like turmeric. We know turmeric is good, but you think you can drink turmeric 365 days for the year? No, 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 no. The hospital will pick you up. You can't do that. The old people have a saying, again, too much of one thing is good for nothing, right? Okay, so let me say again a pleasant good morning to Miss Wendy Jones. She says, good day, Dr. Batson. Always a pleasure listening to you. It's a learning process. When are you getting that? We will get that, God's willing, by next month, please, God. That's an eye drop that we have, that eye drop for cataract specifically, or help significantly with cataract. We do have eye optics formula in stock. as well as our circulation regeneration tea and our nerve restore as well. Okay, question?
Yes. Someone said I used Santulan last month.
Mhm.
Can I dry the used tea bags and sprinkle over fruit at least 3 times per week?
Yes, you can. You can do that because those the herbs in that bag, at the end of the day when you dry it, you do have nutritional benefit to it still as well as fiber. One of the things I often tell persons as well, what you can do is that when you blend, like if you those of you who do your blend, in some cases you're juicing, there are a lot of the roughage that remain. You could actually take that and use it with your breads, to add that fiber to the bread and that type of thing. Of course, you would know what you have and what you peel and that type of thing. You could actually use that as the roughage with the flour to actually make more whole grain bread, put your oats and those type of things in it as well. You don't let that waste. Don't let that waste at all. Next question.
All right. Someone is in their 70s. He has high blood pressure. He has a hernia. And they recommended surgery, but he is scared to do the surgery. Can you recommend anything?
Well, the thing is with hernias are very troublesome, Um, from the perspective of anatomy and physiology, what hernias really are. I mean, you have different types of hernias. You have the ones very close to the navel. I can't remember off the top of my head right now. And then, of course, you have the ones close to the groin area. But what it really is your abdominal muscles, that entire thing there acts as a barrier for your intestines. So it protects it. What happens with a hernia is that you actually have pulling of the muscle apart, and then the intestines, or in some cases, depending on where the hernia is, you'll actually see bulging. Now, if it's very small, when I say small, maybe like about 2 inches, you can get help with it. Um, you can actually get the castor oil and actually start to take castor oil and actually apply it there. Uh, that would help. But the thing is, if the hernia is very large, well, then that's a perfect example of waiting a little too long, where you're going to have to do maybe a hernia repair, where they would actually insert or put in a wire mesh there. But I often tell persons, an ounce of prevention is better than a pound of cure. If you're someone who lifts a lot of things, men especially, women especially, because some women, you always move, you always wait for nobody to do anything for you. So you push things, move things, lift up things. Make sure and do that properly. Don't lift up things that you're not supposed to. There are correct ways in lifting. Learn how to lift things. Make sure and have support, whether you need your belts and those type of things, because that's essentially how you get hernias. And they're very debilitating, especially as you get older, because depending on the size of the hernia, it can actually cause serious problems. Okay.
All right. So Erica in Trin City says to let you know that she's enjoying your program.
Thank you so very much, Erica.
Someone says, Morning, Dr. Batson. Can you talk about the cracking sound of knee bones and what to use?
Yeah, well, of course, the thing is, your knee is going to give you the most amount of problems, or it can. How do I phrase this? Okay, as it relates to imbalances and problems in the musculoskeletal system, you're going to find you get a lot of problem with your knees. Why? Your knees essentially carry you, right? Remember, and then in terms of the type of joint that the knee has a lot of is used a lot. Remember, when you're stooping down, you're bending, you're walking upstairs, so the knee gets a lot of work. If you're a sportsman, if you play, you run ball, you play football, if you're a runner, you're a dancer, these type of things. Women with high heels, we love to see you all looking real nice in those high heels, but we know the high heels are really good for your musculoskeletal system. So, some women have really bad arthritis now because there was hot girls in the days, you couldn't wear higher shoes than some of them, right? So the thing is, I often tell women, you can do those things, but there are exercises that you could do to correct the problems. You see, the thing is, there's always a way to mitigate negative effects of certain things. So there are things that you can do. CMOS, I'm a huge advocate of CMOS. We carry a very good brand at CMOS at Batson and Associates. I went so far to actually get it and source it for you guys. Because CMOS is amazing. I mean, the nutritional benefits of CMOS is it is classified as a nutrient dense food, and exactly that, nutrient dense. So you have things like magnesium, manganese, it's a lot of minerals inside of there, but I think 92 or 98 or something like that, right? So that's always helped with musculoskeletal health. Some of my clients or our clients who got some of the best results, they did use inflammation formula. Inflammation formula is a product that we're going to just have available on the international market because of what it is we're actually doing right now with that product. And, it helps to reduce inflammation in the body. So it would help with knee pains and that type of thing. You could also add chia seeds to that CMOS, and that also going to help as well. Someone is asking me about what type of CMOS is the best. I mean, CMOS gets its nutrition obviously from where the CMOS comes from, right? Because it is a marine phytoplankton and where it's going to pick up nutrients and that type of thing. So you actually have colored CMOS as well. I tell persons, I look at where it comes from. Grenada usually has very, very good CMOS. So that's always a good place, and that's where we get ours, as well as we have some really good local ones here still as well. But it's good. It's a really, really good thing. No milk, of course. No milk. I know when all here, no milk always want to die. But there are so many things you could sweeten things with. You can use dates, you can use raisins, you can use a number of things. You have honey, just a little fruits. So you can actually put a banana in it. All of my smoothies, I put banana because I don't use sugar at all, and it helps significantly. If you are someone who may be diabetic, then what you have to do, you can have it. And if you put a little bit of fruit in it, so kind of have fruit with greens. When I say fruit with greens, you can do like maybe kale is always good to add, as well as this thing, what's this, spinach. Spinach is also very good as well. Spinach actually has a component in it that is really good for muscle retainance, muscle memory, and a lot of things with muscle. I can't remember it off the top of my head. That's something I use in smoothies as well. So it kind of gives you a good balance. And the thing is, as you get older, one of the things a lot of persons experience is muscular atrophy, which is where your muscles, you hear ladies raise up their arms and hit under the arm and say, Dr. Batson, this flabby underarm thing I have here, when I was 20 years, I didn't have that. I was like, when was the last time were you in a gym? Were you ever in a gym? No, well, hence the reason I'm flabby. But, it's a matter of, doing those little exercises. You could get a little weight and do some curls, that type of thing. The thing is, the body is designed to move. It's just like a car. If you buy the best vehicle in the world that they make, best vehicle, whatever it is, whether you're a car fan, Bugatti, Lamborghini, or whatever vehicle, nice thing. And you take it and you park it up and you never drive it. 6 months it stay parked up. When you go and start that vehicle, would it start? No, it would not. So your body is the same. A body in motion remains in motion. A body at rest remains at rest. One of the worst advice you could get from a doctor is not to exercise. And I have known of doctors who have told persons not to exercise. I've had persons who came to me who told me that the doctor told them not to exercise. Listen to me, that is utter and total rubbish. Rubbish, 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 rubbish. You know why? You will get more sick and you will die faster. I'm not asking you, I am telling you. No, it depends on why the doctor tells you not to exercise. So let me explain myself quickly. If you are someone who has rheumatoid arthritis, you are always in pain. Listen to me. Taking painkillers and lying down is going to make your rheumatoid arthritis 1,000 times worse. You have to start to move. So what you're going to have to do is gradually start to do some sort of therapy and gradually start moving. But do not stop moving, because if you stop moving, I am telling you, that is how rheumatoid arthritis patients end up with debilitating arthritis. You have to move. If someone is confined to a bed, they're bedridden, they have to exercise. You need to have the person. Now, this person may not be even with someone who is, let's say someone is crippled. So they may have a spinal injury, and as a result of that, they are crippled, they cannot walk. You need to exercise that person. You need to turn them on the bed. You need to do lifting, because they're just going to waste away there. Why do you think, why do people get bed sores? Bed sores are because of that pressing, that the blood doesn't circulate properly. So persons who are bedridden, you have to have nurses for them to massage them. And that is why I always tell earlier, if you all think health is expensive, try sickness. A stroke is not a nice thing to get. That's why I behaved so last week with hypertension. Because if you have that manner of hypertension, you are going to get a stroke. You know how many people walking around who got strokes already and didn't know they have a stroke? There was someone up to last week I dealt with a client. I said, you had a stroke. She said, Dr. Batson, nobody ever told me that. I said, you had a stroke. She brought the medical reports and I read it. It is in the report, but the doctor didn't explain it to her. She had a stroke. And she didn't have one. She had numerous. It is referred to as a TIA, a transient ischemic attack. So being confined to a bed is not a nice thing, but you have to exercise. You are told you have a cardiovascular problem. This is our next nonsense people just jump up in. Your heart bad. So the doctor tell you do exercise. Really? Well, your heart will get worse and you will die very quick. You have to move, put on a shoes. You're living in a house or you're living in a yard, walk. You could walk if you live in a house and there are stairs in that house, you don't have a problem to exercise. We're telling you about your car exercise. You get up, you say your prayers. Now make sure. Now I'm not going to send anybody to fall along the stairs. What I am saying to you, evaluate yourself. You must know yourself. If you have problems with dizziness, well, you cannot go and walk up no stairs. But I'm talking about somebody, you might have a little cardiovascular problem. You have a little problem with your breathing, with your lungs and things. No. If it is your living room is 10 by 10, you get up and walk, up and down, up and down. You have to do something because if you do not do it, you are going to get worse. You're not going to get better and you're not going to stay the same. You are going to get worse. I am not asking you. I am telling you. So don't let nobody fool you with that nonsense, especially if you're a kidney. Let me tell you something. When you realize your kidney in trouble, watch me. You want to live? You start to exercise. And you'll tell me something different. We have a kidney protocol. It has always worked. Always worked. We just tweak it accordingly depending on the client. There was a client I got. That client came to a stage 5 kidney and we worked with him over a year. When we were finished with that gentleman, in 2 years' time, he went from stage 5 to stage 2. That's one of the best testimonies we have. You hear what it is I say? I tell you, the man went from a stage 5 kidney where they tell him he had to be on dialysis to stage 2, which is a young boy kidney. Up to this day, the doctor shocked still. They want to know what it is he do. And watch me, that gentleman was diligent. Every single thing I told him to do, he did it. He said, Dr. Batson, I have no regrets coming to you. None whatsoever. But he listened. And you have to, and he did the exercise. When he came to me, he said the doctor told him not to exercise. I say, sir, that is madness. You get a shoes and you start to walk. And if you see the type of individual that person is right now, the man have no problem with blood pressure, diabetes, almost, you could say gone. He don't have any problem with sugar. The man don't use insulin again. He said, Dr. Batson, my wife now think good. You know why? He have proper male function. He didn't have that before. Every Monday morning, you in a hospital. Where you're working now. You have a Monday walk there. Why are you in the people hospital? The people hospital is for emergency. I always tell persons that. The hospital is not a hotel. It is not you feel when you go there, they're going to give you salad. You feel they're going to get cup salad in there. Only wait on that. Wait on that. Is bread you're getting. And I am not criticizing. Understand what I'm saying here? I'm not criticizing the people on them. Because people will stand up and say, well, we pay tax and this and that. But the hospital is for emergency. You only don't know that? The hospital is for emergency. I mean, when I say that, in its grandness and purpose, the hospital is for emergency. You have the maternity ward, that is an emergency. You have a baby, you reach the time the baby needs to come out. That is an emergency. You can't stay in there. He or she can't stay. They have to go to the hospital. God forbid something happen to you, fall along, you hit your head, something happen. Hospital. That is what the hospital for. The hospital is not for people who do not listen and who do not follow advice that the doctors have given you and eat what you want, drink what you want, and end up inside of there. It is not for that. And then you're going to lie down and complain and say that they didn't get. If you see the food I get there, the hospital is not a hotel. You think we're going to get salmon in there? Oh, God. Salmon? Watch me. You feel like we're going to get what? Grilled chicken breast? With salad? No. It's bread you're going to get in there and you're going to get constipated. So try your best and do what you're supposed to do and leave the hospital for what? Emergency. Next question.
Yes. Someone says, my sister has short gut syndrome after losing a large portion of her small intestine. She wants to know what she can do to get proper nutrition.
Okay, so the person has, so I wonder if they have a colostomy bag or they just have a smaller intestines.
Not sure.
Ask the question again.
My sister has short gut syndrome after losing a large portion of her small intestine. She wants to know what she can do to get proper nutrition.
Okay, short gut syndrome. I am not going to be one of those persons who feel I know everything. I do not know. I've never heard about this. So I'm going to check it. Okay, right. Short bowel syndrome is a condition in which your body is unable to absorb enough nutrients from the foods you eat because you do not have enough. Okay, small intestines. The small. Okay, right. Okay, I follow now. Okay. So in a case like that now, it means, well, one, you need to start consuming more nutrient-dense foods. So it means what you have to do is increase surface area to volume ratio. But that's going to be a consultation, because we're going to have to find out a number of things as regards to that. And of course, we will have to look at pathogens, any things like yeast and that type of thing in the limited gut that you have. And then we could make the recommendations. But definitely, that is going to be an aspect associated with now increasing your body's ability to actually absorb food and nutrition. There's a product we carry at Batson and Associates called Digestive Formula. We also have one known as it's the yes now, yeah. Stem cell digestive. That is what I was trying to remember. That is a very, very good product, actually. And that helps a lot of things good. Things like gastrointestinal reflux disease, irritable bowel syndrome, Crohn's disease, diverticulitis, all those inflammatory bowel conditions. You get a lot of help from that. Also, persons who have problems with constipation, if you have problems with proper evacuation of waste, a lot of bloating, gas, belching, those type of things, then you're gonna have to look at those products. Okay, so you could always give us a call. Again, those telephone numbers and locations. We are located on the first floor of Money Talks building. That's Money Talks building in Montrose, Chaguanas. That telephone number is 222-8261. That's 222-8261. Debe is the corner of Ramsey Trace and the SS Area Main Road in Debe. That number for Debe is 223-7515. That's 223-7515. St. James is Red Edge Mall, Western Main Road, St. James. That telephone number is 220-8113. That's 220-8113. And Tobago, of course, is the Triangle Building in Scarborough, Tobago. You all can call Latoya in Tobago to get your appointments. That telephone number for Tobago is 226-4553. Again, that's 226-4553, as well as 312-4248. Again, that's 312-4248.
All right, we have another question. Is oat milk or almond milk okay to drink?
Oh, the thing is, those are milk substitutes and alternative. They are good. Of course, do your research where your brands are concerned. I always tell people that. Or if you want, you can make it for yourself. I mean, but yeah, it's definitely good. I mean, even things like almonds, you could, you just get almonds and you blend them up, you put a little sea salt in it, and you have almond milk, right? You have to soak it overnight, of course. You could also make chia milk. There are a number of things you could do, and that's why I say, after God is Google, and do some research.
Someone says last week you mentioned mixing CMOS with another product. What is the name of that exact product?
Oh, that would have been chia seeds, or what we call chai seeds. So you have chia, or chai as they call it, which again is also a nutrient-dense food, very good for the body. I find it tastes so good, but that's really good for you. When I say really good, I mean, y'all, it is amazing the amount of nutrients that thing has. It also absorbs 5-10 times its weight in water, so it actually expands in the intestines and actually helps to clean the intestines. There's actually a product that we're going to be bringing out that's next year, God's willing, where it's going to have that in it, but it's actually going to be an intestinal product, to help to improve oxygen in the intestines and that type of thing. Because again, we have to go with the demand, and we have a lot of clients now with gastrointestinal problems. In fact, that's one of the things we'll be doing at our Londonville office. is really getting persons healthier as regards the gut health, because again we have a lot of colon and colorectal cancer on the rise. Okay.
We have a call on the line. Hello, good morning.
Hello.
Hi, good morning.
Yes, Dr. Batson, I want to know if eating bread will make you get constipated.
Okay, you could listen off, eh? The thing is, it depends on the type of bread and the amount of bread. Most people, bread gonna constipate them because they eat a lot of white bread. One of the problems with a lot of persons is that they will eat bread, but they don't balance. There isn't sufficient roughage in the diet, so they don't use things like oats. They don't use things like sufficient vegetables in the diet. Like chunky veg, those type of things. And the way the human gut is designed, for fiber. Remember, the human gut is 23 feet in length, right? You have your ascending, transverse, descending, and your sigmoid colon. So it means that and your colon isn't straight out. It isn't like a straight line. Your colon is wrapped up. So the thing is, in order for that peristalsis, that muscular movements to be engaged, you have to have fiber in your diet. You have two types of fiber. You have soluble fiber and insoluble fiber. And a lot of those things, seeds, grains, that's things like your almonds, your cashew, things like your oats. Now you hear people talk about celiac disease, and celiac disease is people who have problems with what they call this thing, boy? I remember just now. They have problems with gluten. And the thing is, gluten is in a number of things, especially grains. Now, I believe, and in my experience dealing with people with celiac and other bowel conditions, is not that you're having it. You just have a lot of impurities in the body. And once you have a lot of impurities in the body, it's going to give you a celiac-like response, allergic response. People, allergies, a lot of the times are not allergies. Allergies are toxic buildup in the body that wasn't there, and now because of the chemicals that the food that you used to eat before that you can't eat now exposed to and now reacting with, it now gives you an allergic reaction. So in other words, that people, when you was younger, you could eat fish, and then you get older and you can't eat fish again, you're allergic to it. What changed? Did the fish change? No, your body chemistry changed. Think about it. And that is why you are now allergic, but you're not allergic. The thing is, the liver is so, well, not only the liver, the intestines and a number of things require attention. And that is where Santulan comes in. But of course, hydration before. Keep in mind, not drinking water is like somebody taking a bag and putting it over your head. How long can you stay without breathing? Oxygen is to life what water is to the body. Always remember that. Oxygen is to life to what is like what water is to the body. Always remember that. Hydration is every single thing. Everything. Next question.
What is the benefit of wheatgrass?
One of my favorite things, man. There's a particular one we carry at Batson and Associates for a particular reason as well. That I've been using for like in excess of 15, 16 years. Nutrient dense, very good for cancer, like exceptionally good for cancer. It is also because in it there's an enzyme in it. I believe the enzyme is PD411. What that enzyme does, it has the ability to damage cancer cells. It actually breaks all cancer cells. Cancer has a way, it has a protein shield around it, certain types of cancer. In fact, all types of cancer. And that is what prevents the immune system from getting in there. What that PD411 does is strips and damages that cell so that the immune system can now attack the cancer. So it's very good for things like tumors and that type of thing. Of course, you have to put it in a particular regimen in order for the client to follow. We do offer cancer protocols. I have had some really good success with cancer patients, and success in the sense that they, even though they may have done, because I am respectful of people's opinion, and people, you come to me for a specific reason, and I do my job, right? I work outside of my job in the sense that as a human being I'm dealing with, so I'm going to give you the best advice. But as regards to cancer and nutrition, I often feel sorry for persons because I tell them, regardless of what chemo or radiation or what you decide to do, you need to have a nutritional protocol. You need to have a nutrition. If you have cancer and you do not have a nutritional protocol, you're not going to succeed. I'm telling you, I'm not asking you. I'm not even getting into the politics. You're not going to survive. You're not. The body cannot take all that licks without it getting nourished. Remember, the human body functions on the basis of regeneration, you know. That's the basis under which the body functions, you know. The hair that you have on your head, this beard, when I go by the barber and I mark and thing, in 2 weeks' time, I'll go back. The hair is going to grow back, right? Your bones regenerate themselves. The cells in your eyes regenerate themselves. Your hair follicle regenerates themselves. You get new red blood cells every 4 months. So your body regenerates itself. The question is, it regenerates itself based on what? Would it regenerate itself based on sugar, hydrogenated oils, fats, processed food, processed meat? Then you're going to get cancer. That's exactly what is going to happen. Would it regenerate itself on stress? You're stressed out, you're fed up here, people, you hate the world. It's going to regenerate itself on what? Negativity. Then you don't expect to get sick. You're going to get sick. Because if you're giving your body what your body needs, your body will give you the results. And that's what we do at Batson Associates. We give your body what your body needs. We give you a program. Ask anyone who came to us and got results. That's why they recommend so much people. Is that this? Do you have to have some discipline? Yes. Do you have to have some sacrifice a bit? Yes. Do you have to have some sort of discretion? Yes. Yes, you have to. There was a lady who came to me. I'll never forget this. When they came to me, they said that the doctor, I know our time is almost up. The doctor told her she was diagnosed with colon cancer. And she said the doctor told her she could eat anything she wants. I said, good, well, he doesn't think you're dead already, so he basically sending you faster. And she was offended. I said, okay, good, no problem. I said, well, I was not attempting to be rude, but I was attempting to be blatant with you because I am not going to cover. I don't have time for that. I said, listen to me. When I looked at the whole everything, this person loved meat. When I tell you loved it, they loved meat, love meat. And I said, this was one of the reasons that you're in the position that you're in. People don't like to hear that, you know. They just like to hear you tell them that. But again, I said, you can only reap what you sow. You want to come and me to give you a different answer? You know, you feel bad smart. I mean, I ain't little too correct in my head, but I'm convinced I ain't that is saying. Yeah, no, that can work. It can work. So you have to understand the consequences of your action and now be big enough, man enough, woman enough to say, hey, you know, I do little foolishness. Maybe I didn't know. Maybe I didn't care, but I care now and I know now. And I'm going to fix it. That's all. But you can't expect to do the same thing over and over and get a different results. So it is now 11:36. I believe we're very close to finishing. Correct? I see you. Is it that you wanted to take a question again? Tell me. You guide me accordingly.
We have two questions.
Okay, good. No problem.
Someone said, you said on a previous program you would not give someone with depression and anxiety Santulan before treatment. I was wondering why not.
Because if the person has depression, I mean, it depends on what we're dealing with. If we're dealing with a PMS, if we're dealing with a young child, whatever the case may be. But the thing is, what happens, the body is already spent. So in terms of cleansing and detoxifying, we wouldn't go that way first. We can't go that way first. That doesn't make any sense. What we're going to have to do is evaluate the client from the aspect of the blood and the magnetic resonance, primarily blood, especially oxidative aspect and thing. So the body's already broken down. So what we have to do is build up the body properly and then detoxify. And in building, the body would get what it needs because of the dynamics in terms of the way that you do it. You know, that's almost trade secret there, but it is, there's a particular way for it to be done. And once our evaluation, we do our necessary evaluation, then we would make the necessary recommendations per individual. That's why that person, if you give them Santulan and they're already depressed, most persons could be as a result of a nervous breakdown. Most people get nervous breakdowns and don't know it's a nervous breakdown they get to know. That's the next thing I've realized in it since I've been in practice for a number of years. A lot of people, they came and I was like, I could have spot on. I was like, you had a nervous breakdown. The doctor didn't tell them that. I said, well, that's what you had. The symptomology that you experienced at the diagnosis with depression, anxiety, schizophrenia, bipolar is just a consequence or a secondary result of the initial problem or the primary problem, which is nervous breakdown. So you can't give a person like that Santolan. That's definitely call the office consultation business. Okay, next question before we finish.
What food or herbs can speed up metabolism if it is slow?
The thing is, what I would do as regards to metabolism, you have some herbs that have adaptogenic properties associated with them that would help. But in my experience, that doesn't work in the sense that the fastest thing to speed up metabolism is change the way you eat, as opposed to eating large meals. So what some people do is eat once for the day. That's a horrible habit. Don't do that. That's madness. Don't do that at all, at all, at all. You're going to put yourself in a lot of problems. What you need to do is now have more smaller meals during the day. So what you do now is give your body work where your body has to always be breaking down and foods and that type of thing. There's a product we carry at Batson and Associates also called Digestive Balance and Digestive Restore. That would help as well because it will help the body to break down the food completely or more complete. A lot of people do not assimilate their food properly, and those products are basically do that, as well as the stem cell digestive is also a very good product as well, that we could actually make some recommendations with as well. Okay. One of the things as well, you were going to say something?
I was going to take a call.
Okay, good. No problem. Go ahead.
Hello, good morning.
Yeah, good morning. I wanted if Dr. Batson does test people to know if they have diabetes.
Yes, we do. We do. There are a number of things that we deal with. You know? I mean, I tell people we deal with everything. Once he's a human being, I didn't do veterinary medicine, even though I like animals, but so once he's a human being, we could deal with you, man. Women with polycystic ovaries, fibroids, ovarian cysts, women who suffer from PMS, men with prostates. Remember, this is your time, so sort yourself out. Call the office, find out what we have available for you guys until the year is out. Keep in mind, prostate formula is also the product of the month. Ladies, I have not forgotten you. I will ensure that I make up. Keep in mind as well to Tobago from next week, please God. That number for Tobago is 226-4553. That's 226-4553. We also have Eye Optics Formula Nerve Restore, that eye drop that helps with cataract, glaucoma, all those problems with your eyes. You're diabetic, you want to prevent issues with your eyes, check it out. We have a lot of clients with glaucoma who got exceptionally good results with that eye drop as well. Circulation regeneration tea, good tea to check out as well as some of the other products that we carry at Batson and Associates: advanced chlorophyll, inflammation formula, women's formula, male boost. We have thing for thing. Okay. As we always say at Batson and Associates, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. To the listeners of Sky 99.5, thank you very much for listening to me on this day, the 12th of November, 2023. I hope I didn't give too much of problems. And that you heed the advice. Try and drink some more water. Even if it is, you can't come to Batson Associates and get our excellent Alkagen water. And believe me, you'll not be disappointed. At least get a filter and drink your water for me, please. And do something today, tomorrow, every day to make you a healthier you. Okay, God bless you guys. Adana, yes. Yeah, good. I know how to get it. Adana, it was a pleasure. Yes, to that lovely, well, not lovely, to the gentleman that you call husband. Good morning to you, sir. And take care of yourselves until next week, please God.
Have a good one.
You as well. Take care. So, social media, all our wonderful persons. Miss Dawn Ellis, you have something that I need to address for you. I'm a bit surprised. But I'm going to address it. I'm going to make sure the office deal with that. So, guys, this brings our program to an end. It was indeed a pleasure to be with you guys today. Keep in mind, those products, those services, our Shogunas office is located on the first floor of Money Talks building. That's Money Talks building in Montreal, Shogunas. That telephone number is 222-8261. That's 222-8261. Debe is the corner of Ramson Wood Trace and the SS Erin Main Road in Debe. That telephone number for Debe, 223-7515. St. James is Red Edge Mall, Western Main Road, St. James. That number for St. James is 220-8113. And Tobago, of course, is the Triangle Building in Scarborough, Tobago. That number for Tobago is 226. That's 226-4553. 226-4553, as well as 312-4248. We have our social media. We are Batson Associates Limited on Facebook. On Instagram, we are Batson Associates TT. On YouTube, we are Batson Associates Trinidad. And on TikTok, we are Batson and Associates. Take care, guys. Always a pleasure to be in your company. Remember, Tuesday, we would be on Isaac Be Promise, and that is from 11 to 11:15. And keep in mind, we always have our Thursday programs on Thursday from 11:05 to 11:25. It's 103.1 FM. Then from 1:15 to 2 o'clock, we go to Freedom 106.5 FM. And from 2:15 to 3:15, we are with DJ Mamu on djmamuradiott.com. Take care, guys. God bless. Remember, share us, like us. What do you do now? Like, follow, share, tag. What's the how to get this order this thing in now? Is add, follow,
You can also subscribe.
or subscribe.
Subscribe to our YouTube channel.
Okay.
But to keep it simple, follow, like, share.
Follow, like, share. Let me keep it simple. So follow, like, share. Take care, guys. God bless. Bye-bye.